Okay, so good morning, everyone. Welcome to the Pre-Retirement Seminar for Classified Staff, Spring 2026. My name is Talene Spengian. I'm the Director of Benefits in the CUNY University Benefits Office, and I'm assisted today by my colleague Jenna Maynor Pilgrim, who's a Benefit Service Manager, and Delfino Rojas, who's a Retirement Coordinator. These are the agenda items that we're going to go over today. I'm going to give you a very broad overview of these benefits. If you have questions about your specific circumstances, make sure that they don't get into the nitty-gritty of your particular situation, because we don't want to take up people's time. I'd rather spend this time answering general questions, and if you have specific questions that are very particular to your circumstances, feel free to email me and I will assist you offline. Verification of service is really the key to everything. All your retiree benefits flows from verification of service. You can go to your Human Resources office and get your years of service, compare it to the years of service that you understand that pertains to you, and also compare it to your years of service with your pension system. They don't always align, and sometimes there's gaps in information. And so this is the time before you actually file for retirement to make sure that all of your service is accounted for, that it's been reported to NYSERS, so that when you go to apply for your pension, there aren't any issues. Sometimes employees come to CUNY in a title that is not pension eligible. Maybe it's a part-time position as a college assistant, for 10 hours a week, working at a campus while you're going to school, or whatever the case may be. So not all service is pensionable, but time that you worked that you did not get credit for, you can buy back if it predates, even if it doesn't, if it predates your membership date to NYSERS, or even if there are periods after your NYSERS membership that may not have been credited, that time can be credited and bought back also. While NYSERS membership and the tier that you belong to is based on your the date that you join NYSERS, and number of years ago, a few years ago, the New York State reduced the number of years to vest in NYSERS to 5 years. However, the Office of Labor Relations, who manages the retiree health plans, still requires that you have 10 years of service in order to utilize the retiree health benefit. And we're going to talk about that. But so you still need 10 years of service, even if you only need 5 years to vest with NYSERS. And the premiums for the retiree health plan will be deducted from your monthly pension check. That's how it's paid for. So Medicare coordination is really complicated. It causes a lot of confusion among employees looking to retire. They want to know, when do I apply for Medicare? How is it coordinated with my retiree health? What happens to my spouse? And these are all valid questions. So what we've done is created a chart, which I'm going to walk you through to help explain how to read this so that you can always refer back to it when you need to. So this is the chart that we created. So let's look at the first row. It pertains to active employees. So, and in the left column, it's for active employees who are under 65. So what happens if you're an active employee and you're under 65? you're enrolled in a city health plan, and Medicare Part A and B are not applicable because you're under 65. If you're an active employee and you're over 65 in the right column, you also remain in the city health plan, because as long as you're actively working, you remain in an active city health plan. You can enroll in Medicare Part A if you would like within 3 months of turning 65, but you do not enroll in Medicare Part B. There's a cost associated with that. And as long as you're actively enrolled in an employer health plan, you do not have to enroll in Medicare Part B. So what happens? Let's go to the next row. What happens if you are the spouse? What does the spouse of an active employee do? If you are the spouse of an active employee and you are under 65, you are enrolled in a city health plan, and Medicare Part A and B do not apply to you because you're not 65 yet. If you're the spouse of an active employee and you're over 65, again, you remain in the city health plan because your spouse is still actively working. You are covered under an active employer plan, and you do not have to enroll in Medicare Part B. But you can, if you wish, enroll in Medicare Part A within 3 months of turning 65. So let's see what happens when you retire. So in this first row, you are a retiree, you're under 65, you are enrolled in a city health plan, just as you are as an active employee, and Medicare Part A and B do not apply because you are under 65. So even though you're retired from CUNY, based on your NYCERS tier, you still remain in an active health plan. Once you are over 65, everything changes. So we look at the right column. If you're a retiree and you're over 65, you enroll in a senior care plan. And a senior care plan is a plan that is similar to the active plan, except that behind the scenes, it's coordinated with Medicare, such that once you enroll in Medicare and you're retired and you're over 65, Medicare is your primary coverage and the senior care plan is your secondary or supplemental plan. So if you're a retiree and you're over 65, you enroll in a senior care plan. You enroll in Medicare Part A within 3 months of turning 65 if you haven't already done so. You enroll in Medicare Part B within 3 months of retirement or turning age 65, whichever comes later. The effective date of Medicare Part B should be the first day of the month in which you retire or turn age 65, whichever comes later. So for example, if you are 65 and you're retiring on June 15, you will enroll in Medicare Part B as of June 1st. So the first day of the month in which you retire or turn 65, whichever is later. Medicare Part D is the Medicare drug plan, but because you are a member of DC 37, that is where you will get your drug plan. You do not have to enroll in Medicare Part D. One caveat is that if you are in a title that is not covered under DC 37, and if you're in one of the other unions, you have to find out from them if they offer retiree drug plan, or many of them require that you purchase your own drug plan. For example, while you were working, you had to buy the drug rider for the health plan. That means that your union doesn't provide a drug plan. So, but even if your union does provide a drug plan, I don't know which ones offer them to retirees. So it's on you to contact your union to find out if they offer a retiree drug plan, and if not, you may have to enroll in Medicare Part D. So this is basically the way that this chart is red, I hope that it's clear to you. I hope that you can refer to it and it'll answer a lot of your questions. There is one caveat though that I need to go over. So if you are a retiree, if you have a domestic partner on your plan, and you're, even if you're not 65 and you're still working and you're still in the active health insurance plan, if when your domestic partner reaches 65, they must enroll in Medicare Part A and B. They are not immune. They're not protected from that rule that exempts you if you are covered under an employer plan. Because the federal government doesn't recognize domestic partnerships. If you're married and your spouse is on your plan, they don't have to enroll in Medicare Part B. But if your domestic partner turns 65, whether you're working or not, they have to enroll in Medicare Part A and B. And if they do not, they will incur a late enrollment penalty. And that penalty stays on your premium for the rest of your life for the domestic partner. So I hope that clears things up. Again, if you retire before age 65, you remain on your active health insurance plan. And if you retire after reaching 65, that's when you enroll in Medicare, and it's coordinated with your senior care plan. Just to clarify, in case you don't know, Medicare Part A is the hospitalization part of Medicare. Medicare Part B covers physician expenses, and if you enroll in the most commonly used retiree health plan is the GHI Senior Care Plan, and the reason for that is because it has a special coordination with Medicare that doesn't that is not the same with the other senior care plans. The GHI Senior Care Plan, as long as you go to a doctor that accepts Medicare, Medicare will cover 80% of your claim, and the GHI Senior Care Plan behind the scenes covers the balance, the 20% balance. So what happens is, even though you're covered under the GHI Senior Care Plan, when you go to a doctor, first you give them your Medicare card. The doctor files a claim with Medicare, and then whatever Medicare doesn't cover, they send it to GHI, and the senior care plan will pay the 20%. That's how that works. And the benefit of the senior care plan is that because it's a plan that covers Medicare doctors, all doctors who accept Medicare, it doesn't matter where in the country you live after retirement. So there are Medicare doctors nationwide, no matter what state you live in, including Puerto Rico. So regardless of where you move, as long as you're in the GHI Senior Care Plan, you can go to any Medicare doctor in any state. So this coordination works anywhere in the country. Where it doesn't work is if you move out of the country, because if you retire and move out of the country, Medicare will not cover any of your medical benefits. So Medicare doesn't work outside of the US. And also, if you're enrolled in Medicare, but you reside outside of the country, you will not be eligible for the Medicare reimbursement, which is something we're going to talk about in a second. That's another one of your retiree benefits, is that the cost of Medicare is reimbursed to you. But if you live outside the country, that is not the case. Another thing that you need to know is that if your spouse is on your retiree health plan and you pass away, your spouse is no longer eligible to remain in that retiree health plan. So they won't be able to stay in the plan, and they won't be eligible for the Medicare reimbursement after you pass away. Your spouse can stay in the plan through COBRA for up to 36 months, but that's all. It's just a 36-month period. So, alternative arrangements need to be made by your spouse in the case of your death. Again, Medicare Part D is only for those who are not covered under DC 37 drug plan, or their union doesn't provide retiree drug coverage. And we're going to have a presentation by DC 37 in a few moments. Also, annually, you can change your plan if you wish to. During open enrollment, there isn't a transfer period for retirees as well. So in usually the month of October, if for whatever reason you don't like the health plan that you're in and you want to change it, you can during open enrollment. And now I'm going to pass it off to my colleague Delfino, who manages the Medicare Part B reimbursement program.
Good morning, Talene. Good morning, everyone. So as part of your retiree benefits, you are eligible to be reimbursed for your Medicare Part B premiums. Um, the way this works is you apply and submit a copy of your Medicare card to the city's Office of Labor Relation, and they will process your payment the year after you retire. For example, if you retire this year, you will receive your first payment next year in April 2027. April is usually the time for all retirees to receive their reimbursement if all the forms have been submitted to their office. Usually, the forms will be provided to you by your HR office, along with all of your other retirement paperwork. And once you submit it to them, they will pass it on to the city on your behalf. So you don't have to do too much there. Sometimes retirees won't be 65 at the time of their retirement. And what you will want to do there is either reach out to your HR campus or the city's Office of Labor Relations. Just a quick Google search will yield their office information, their email, their number. But like I said, you can always reach out to your HR campus once you are eligible, if you're not eligible at the time of your retirement. Uh, your payment will be issued the same way that your pension check is. So if you receive direct deposit, you will also receive the payment by a direct deposit to the account you receive your pension. Uh, there have been situations where the retiree will reach out to me regarding their a change of to wanting to change their bank account. And the way that you change it with the city is the same way that you change it with your pension system. So if you want to make a change, you have to do it with your pension system, and then they're the ones who are going to let the city know that it's changed. You don't go to the city to change your direct deposit information. When it comes to the IRMA, the income related monthly adjustment amount, uh, this is an additional payment that the Social Security uh, deducts from your Social Security benefits because of your income. If your income is high based on tiers that they decide on, uh, you will be paying extra for Medicare Part B, and this amount can range anywhere from $30 to $500. Um, this amount is also reimbursable, but this amount always requires that you file an application with the city directly. It's not with anyone else, with them. Uh, they make the applications available every May, and they issue the IRMA checks in October. Uh, just like the standard payment, you will receive this payment the year after you're retired for the prior year. And for this one, the application and the whole process to apply for it starts in May, and the checks are issued in October, and also the same way that your standard payment is issued, which is either by check or direct deposit if that's how you receive your pension system. Uh, I know that this is a lot of information coming your way, so please do feel free to reach out to me or to Lean if you have any questions after this seminar. And as you're seeing in the screen right now, just to wrap it up, the applications for the city can be submitted for the IRMA can be submitted either through mail or through their online portal, which you can see on your screen and on the slide. Thank you, and I'll pass it on back on to Talene.
Thank you, Delfino. The next topic is terminal leave. So as a classified employee, you have the opportunity to have unused sick leave paid out to you upon retirement. The calculation varies depending on your title. If you've run out of sick leave, it could be based on your years of service. When you go to your benefits officer to have a retirement consultation, you can talk to them about terminal leave. They'll do the calculation for you. If you have the option of sick leave or years of service, they will do both calculations and then tell you which one is more beneficial to you. And if you've worked at another city agency, and if you don't have the necessary years of service, for example, the first tab says employees with 10 years or more of service. If you haven't been at CUNY for 10 years, but you've worked at another city agency, those years will be factored into this calculation. So if you worked 2 years at the Department of Ed or Department of Sanitation or whatever the case may be, those years can be added to your CUNY years in order for you to be meet the 10-year minimum and also possibly increase what your terminal leave payout will be. So your years of service from other city agencies counts in this calculation. So keep that in mind. And you should tell your benefits officer that you've worked at another agency when you go to meet with them. For eligible 220 titles, the calculation is slightly different and the rules are slightly different. I won't go into the detail of that, but the benefits officer, based on your title, will know which calculation to apply. There's an annual leave cap on how much annual leave can be paid out to you in a lump sum. For most people, it is 45 days. So if you have more than 45 days of annual leave, you should think about spending that down if you're going to receive your unused annual leave in a lump sum. Some campuses pay out your unused annual leave on a biweekly basis, and then this cap wouldn't apply. But it depends on what your campus does and based on the number of hours that you've accumulated. The transit benefit seems to be a very problematic issue for retirees because very often employees over contribute to their Eat and Read account, their commuter account. From the time that you retire, you have 90 days to spend down that money. Anything that you don't spend in those 90 days is lost. And so we don't like to see you lose this money. Because this is a pre-tax benefit, it is governed by the IRS. The IRS makes the rules for this, we do not. And so if you have an overaccumulation in your transit account and you don't have enough time in the 90 days to spend it down, you're going to lose that money. I just got an email from someone about a month ago. They retired a year ago and they had $1,700 in their transit account and they lost the entire thing. There's no way to get that refunded to you because it is a pre-tax benefit. And so especially during COVID, many of us worked from home. We didn't commute as often as we normally do. Our transit expenses changed, sometimes went down. If you're over 65, or I believe it's 65, maybe you were eligible for a senior discount on your Metro, on your MTA pass. And so maybe you continue to over contribute to your transit account. So this is time to look at your balance, log into your account, look at your balance, see how much money you have there. And if there's too much money for you to be able to spend in the remaining time that you're going to continue working at CUNY before retirement, maybe go to your benefits office and reduce your contribution down to $1. You can do that and stay in the plan. So reduce your contribution to $1 so that you're not continuing to accumulate funds there and plan on spending that down. We don't want you to lose money on this deal. It was supposed to be a tax benefit for you. And if you're going to end up losing money in the end, it was pointless. So look at your transit account accumulation and make sure that you spend it down within the night, up to 90 days after retirement. The same concept applies to the FSA, Healthcare Flex Spending Account. Whatever money you put in there, if you don't spend it within 90 days of retirement, you're going to lose it. So look at how much you spend. Unfortunately, with the Health Flex Spending Account, once you commit to contributing an amount at the beginning of the year, you're locked into that you can't change that amount. So there are other strategies on how to spend it down. You can talk to your benefits officer about what those options are, but make sure that you don't over contribute to this and end up losing money in the process. So pay attention to this account also. And this is a little harder to work with, to manage, because you have to send in receipts to the city and sometimes they're backlogged. So it's hard to gauge what you have, but you should definitely look into this now and consider either changing the amount for next year if you're still not ready to retire, but make sure that you manage the funds properly so that you don't lose money in the end. Retirement counseling is important. I know that people call NYCERS and want to make appointments to go down. They're not doing in-person appointments anymore. They don't want you to just show up at their office, but they have calculators on their website that you can log in and estimate what your pension is going to be, and you can make an appointment to talk to somebody. They're kind of backlogged, but if you have a problem getting in touch with them, email me and I'll try to intervene on your behalf. But you should go to retirement counseling so that you know what your options are when it comes to retirement, whether you want to name a beneficiary or not. And there are a lot of decisions to be made. And in case you're not aware, it was in the invitation for this meeting, but there is a pension and retirement seminar next Tuesday. If you haven't already registered for that, you really should. It's very valuable information, and there's a really important presentation by NYCERS, and it's always the hit. Frank Brown is a very good presenter, and it'll be your opportunity to ask questions of him until you are ready to retire and need to actually, get on the phone with someone. It'll give you a lot of good information so that you're educated when you go to apply for retirement for your pension. Tax deferred annuities. This is another topic that's going to be discussed next Tuesday, but I just want to go over it really quickly. As a CUNY employee, you're eligible for participating in the TIAA tax deferred annuity. The annual maximum for 2026 is $24,500, and there are additional catch-up amounts. So if you are between the ages of 60 and 63, you can contribute an additional $11,250. After that, if you're 64 plus, there's an additional 8,000 if you're between, over 50, but then over 64. In addition to that, even if you're only a few years away from retirement, if you can afford to, it really behooves you to contribute as much as you can in a pre-tax investment fund. In addition, the New York State Deferred Compensation Plan is an additional investment vehicle for you. So, and these two plans are not coordinated. So what that means is you can max out on what you contribute to the TIAA tax deferred annuity, and you can max out on the New York State Deferred Compensation Plan. So in effect, you're doubling how much you can contribute on a pre-tax basis to a retirement account. So there will be someone talking, presenting from New York State Deferred Comp Plan next Tuesday also, and as well as TIAA. So they'll go into a lot more detail, but these are two plans that are available to you and that you should consider participating in if you can afford to. Working after retirement is a really popular thing at CUNY. People retire and they still want to work. They still want to come back and work. But there are restrictions if you are in a public pension system. So if you're in NYSERS or TRS and you retire, you start collecting a pension, and you're under 65 years old and you want to work for another New York City or New York State agency, you have an earnings limitation of $35,000. If you earn in excess of that, your pension check will be paused. NYSERS will stop your pension check because you are earning above the limit. So this only applies if you are under 65 and retired and you work for a New York City or New York State agency. If you are over 65, this earnings limit does not apply. And if you work in the private sector, it does not apply. It also doesn't apply if you work in a state or city agency outside of New York. So if you work for an agency in New Jersey, this earnings limitation doesn't apply. So change of address, banking information, beneficiary information, these are all things that you should keep all these different entities apprised of as they change. If you have a change in your marital status, your banking information changes so that your pension check has to be moved to a different bank. Everyone that you're affiliated with should be notified of all these changes. None of them talk to each other. None of the information is shared. So it is kind of a burden on you to make sure that your HR office knows how to get in touch with you, your union, DC 37, and certainly your pension system should be able to get in touch with you no matter where you are. If you move out of the state, if you move anywhere, you should make sure that everybody has your current information in case they need you or need to share information. And that's about it for me. I'll stop sharing my screen now and see if we can take some questions. I see a lot of questions in the chat function, and not very many of you use the Q&A, which we asked you to do, but it's okay. So let's see, what is the amount of money that considered high for the IRMA? The IRMA income ranges, there are four tiers. I don't know them off the top of my head, but if you Google IRMA 2026, it'll give you what those ranges are. It'll give you what your individual income range is and your joint income range if you file taxes with a spouse. So that is something you can Google. I don't have that off the top of my head.
Thank you. Delfino answered.
Oh, Delfino answered. Great. Okay, thank you, Delfino. Okay, can the balance be transferred to Omni cards? I'm not sure how that works, honestly, to be honest. But that's a good question. I'll find out. Are employees automatically enrolled in these tax? No, they are not. The tax savings plans are all voluntary. A link to the register for the seminar. The link to register for today's seminar is the same link that you can use to register for next Tuesday. So you can go back in and register for that. And if you can't, just email me and I'll send the link to you. Is DC 37 and IBT 237 similar? DC 37 is a welfare fund. So it is a fund that provides hearing, vision, drug, and dental coverage to members. IBT 237 is a union. But I don't know off the top of my head if that title is a DC 37 title or not, but I could look it up. Does anybody have a question that they want to ask by unmuting themselves and asking a question? You can do that. No? Nobody has any questions?
I have one.
Okay, go ahead.
I worked in a different college as a college assistant.
Mhm.
So that's pre-NYSERS credit, correct?
If you hadn't joined NYSERS yet, then yes.
Yes, that is the case. Who
Okay.
would be contacted because there's a different school? Do I contact the college that I did the pre-NYSERS?
So you would
again?
you would contact NYSERS. You would
Okay.
tell them that you want to buy back time for work for a period of time that you worked at CUNY before you joined NYSERS. And then they will reach out to that college. You'll tell them they'll ask you which school, and they'll reach out to that college, ask them to verify the dates of service, and then they will tell you, they'll do a calculation and tell you what you have to do to get credit for that time.
Thank you so much.
You're welcome. Anyone else?
I have a
Yes.
question.
Okay.
Whoever said yes, you can go ahead.
Okay. I wanted to this to be clear about Medicare. When you turn 65 and you're still working, do you have to excuse me, enroll in Medicare A, or can it be
Only you don't have to. If you want to, you can, but you don't
okay,
have to.
there will be no penalty
No,
if
there's no penalty for Part A.
okay. I was kind of
I have one question.
for that. Yeah. Thank you.
Okay.
Hello?
Yes, go ahead, ask your question.
Yes. You explained this, but I missed. I'm sorry. I missed your explanation. I'm 75 years old and I have only Part A Medicare. So I applied for this Medicare when I was 65. Now, do I have to apply for Plan B after I retire? And who is going to pay premiums, Medicare premiums? It's $300 per month.
Right, right.
And they told me when I denied Plan B that when I will reapply to Plan B, they will force me to pay for all these years I missed. So
No. So the way it works is when you retire, the month in which you retire, or you can do it up to 3 months before you retire, you apply for Part B, you make the effective date the first day of the month in which you're retiring,
yes,
and then every month you will pay, they'll deduct the premium from your Social Security check. But then so for example, if you retire, let's say in August, you apply for August 1 effective date, and next April, you will receive a reimbursement for the prior year. So from August to December, whatever you paid, next April, you'll get reimbursed. You'll be reimbursed, if you're in NYSERS, you will, receive that payment, direct deposit into the account in which your pension check will go. And
It's
once you
applies.
and once you apply for the reimbursement,
Tap the backboard too.
It's, I'm sorry, it's applies to my wife too, because,
Yes.
yeah.
Yes.
So the check I will receive will include reimbursement for my part and my wife's part I paid, right?
Yes, yes.
Okay, thank you very much. Now
Okay.
I will mute myself.
Okay.
Colleen, I have a question. Good morning.
Yes. Good morning.
I have a public safety. His title is a campus public safety security assistant. He's over the cap for about 25 or 30 days. I think his cap is 50. Can he get paid for those days? Because he's going to retire soon.
I think that I'm not exactly positive. I know that cap applies to senior colleges because it's a rule, it's an OSC rule. They don't like to pay. I'm not sure about PMS or FISA if they pay out in a lump sum if they have a cap. I did
Okay.
reach out to someone and ask, but they never got back to me.
Mhm.
But it's better if they spend it down. If you're going to pay them in a lump sum, it's better that they spend it down,
Okay.
exhaust it bi-weekly
Mhm.
until they
Okay.
reach that limit and
Okay.
then get paid out a lump sum for the 50 days.
Okay. Thank you.
You're welcome. Does anyone else have a question?
I have a question.
Okay.
About your direct deposit. Do you have to suspend that once you retire, or you can continue direct deposit if you I don't know, whatever funds you need to put into it?
In your bank account where your paycheck goes?
Yes.
Your paycheck stops, but when you apply for your pension, you will give them whatever bank account information you want. So they'll direct deposit it into whatever bank you instruct them to do. It doesn't have to be the same account that your paycheck goes into.
Okay, understood. Thank you.
You're welcome.
I have a question.
Yes. Casey. Hello?
Casey, you're muted.
Yeah, I'm
Unmute
sorry.
yourself.
Yeah, I hit the button by accident. Anyway,
Okay.
I missed the beginning. There was a subway train delay. But anyway, now I have a question regarding the remaining sick days you have. I saw before on the slide that they will pay up to 120 days regardless how many sick days. Let's say you have 500 sick days remaining, and they will pay up to 1 day per every 2 days remaining, or
Right.
they will
So
pay up to
half
120
it,
maximum. Yeah.
right. So if you have 500 sick days, that's 250, but the maximum's 120.
120. Okay, that's what I want to know.
Yeah.
Very good.
Yeah.
Okay. Thank you.
Okay.
Question. So what happens to the remaining sick days? Do you lose it?
They evaporate into thin air.
Oh my goodness.
Yep, been there.
That's what you get for never being sick.
Or you could contribute to
Celine,
before you leave.
can they also donate them to the sick
Yeah,
leave,
you can.
catastrophic sick leave?
You can't donate it as you're walking out the door.
Right. So you would, like, if you know you're leaving next year or the year after, like if it's
You could
a couple of years
donate,
away, you
yeah.
could start donating them because again,
And
the
you
cap
could,
is 120. It's a use
right.
it or lose it, unfortunately, when it's time to retire.
And we also have a dedicated sick leave program. So if you have a
Mhm.
colleague that you know needs sick leave and you have an excess number of days and they need it, you can donate to a colleague. But you can't donate your unused sick leave on the way out the door.
I have another question, Talon.
Okay.
Yes. I missed the beginning, like I said, about Medicare because of the subway delay. I got in here late. One question I have is now when you retire, let's say I'm still working at 65. I'm still working for CUNY. Do I only apply for Part A at 65, or I have a choice to wait till till 67 or the day I retire?
For Part A, you can apply when you're 65. It's not mandatory. It's up to you. You can if you want. There's no cost.
Right.
But one of the confusing things is that people, once they enroll in Medicare Part A, if they go to the hospital and they hand over their Medicare card, the hospital files a claim with Medicare as if it's primary, and then Medicare pays it, and then they try to get the money back, and it gets confusing. So as long as you're working, even if you're on Medicare, your active health insurance is your primary plan. So if you go to the hospital, you should still only show them your health insurance card, not the Medicare card.
The
Because
Emblem Health
that
and
creates a lot of confusion. But
right.
you can apply for Medicare Part A, go through that process, put it in your back pocket, never take it out. And then when it's time for you to retire and enroll in Part B, all your information is just there. You're just adding Part B. It just makes the transaction a little simpler
Right.
because you're already in their system.
There's this guy from an insurance company who's coming over to my house, and he want to talk to me and my wife regarding Medicare Part A.
Don't talk to him. Don't invite him to your house. He's
Okay,
going to try and sell you a Medicare Advantage plan.
correct.
The year in which you turn 65, people are inundated with mail from private companies about Medicare Advantage plans. You do not apply for that. The plan that you have as a CUNY retiree is one of the richest retiree plans you could ever have. Between your senior care plan and your Medicare, that is reimbursed to you. So even the Medicare is not costing you money. There is no better arrangement than what you have. You do not need a Medicare Advantage plan. Do
Right.
not invite them to your house.
My sister also told me do not get involved with Advantage. It's really it's expensive and
for people who don't have a retiree plan like CUNY employees, it makes sense. But for someone who has access to a senior care plan coordinated with Medicare and the Medicare cost is reimbursed to you, you do not need to enroll in a Medicare Advantage plan because a
so
Medicare Advantage plan limits you to their network.
right.
In the traditional Medicare plan that you're going to be in, Part B, you have access to every doctor in the country that takes Medicare. But with the Medicare Advantage plans, those networks are small and fewer doctors want to get involved with them. So you can't just go to any doctor you want. You can only go to their network doctor. So you will be restricting yourself. You'll be restricting your options if you do that.
So your advice is even though I'm turning sick, if I turn 65, I'm still working, just stay with the CUNY, CUNY health plan that I have now. I don't have to join Medicare A, B, or anything. Just stay what I have now.
Right,
Correct?
right.
Until the day I retire, decide
Until
to
you
retire,
retire, right,
then I could join Part A and B.
right.
Okay, so I don't invite this guy, right?
Don't invite him.
My mailbox is full of those letters.
Yeah, put him in the garbage.
That's what I do. Just strip it
Good.
off.
Okay, so I gotta tell this guy, don't come over now. Not yeah. Okay. So just stay with the CUNY medical
Yes.
plan. Yeah, it's working great so far. I mean, I just when I retire, just think about 6 months before I retire, actual retirement, going to Medicare and part. And who usually contact me? Is the Social Security office or start mailing me something, or do I have to
When
contact
you
them, let
go
them know?
to, when you decide to retire and you make an appointment with your benefits officer at your campus, they
Okay.
will give you all the forms you need and they will give you instructions and they will tell you what to do with regard to Medicare.
So I'll come to you?
You can apply online for Medicare.
Okay. So when you say the campus officer, like you, right? I mean,
No, not me. What
oh,
campus do you work at?
I'm working right upstairs from you, on 6th floor.
Oh,
CIS,
you're
yeah.
at Hudson Street.
Yeah, I'm a
Your
Hudson.
benefits officer is Gary Yip.
Gary or Jawandi, reach out to either of them and they'll be able
Yeah,
to help
Gary
you.
or Jawandi. That's your benefits officer.
Before I retire, reach out to them. Gary Yip. Okay,
Yep.
very good. All right, very, very good. Thank you.
Okay, you're welcome. Any other questions? Someone in the Q&A asked if a retiree dies, does the spouse have access to the senior care for life, or it's only for 36 months through COBRA. If you pass away, your spouse can stay on your plan for up to 36 months, but they have to pay the COBRA rate. It's not the same rate as a retiree.
There will be the recording will be available, right?
Yes,
Soon
the
after
recording will be available. Yes.
after the meeting or a day later, 2 days.
Next week probably.
Okay, thank you.
It's not immediate.
Okay.
Okay. Are there any other questions? I will look at the questions while the next presenter is presenting, and I'll answer them as we go along. So if you have questions, put them in the Q&A and I will answer them as we go. Our next presenter is Crystal from DC 37. Are you there, Crystal?
Good morning, I am. How are you?
Great. Hi, I'm good. How are you?
Doing good. I'm going to share my screen if that's okay.
Okay, go ahead. Thank you.
Okay, so if someone can just give me a thumbs up that you guys can see. Let me just start it from the beginning. Let's see if you guys can see it this way. Can everyone see it okay?
Yes.
Okay, perfect. All right, so good morning, everyone. My name is Crystal Bryant Nixon, and I am with DC 37 Health and Security. So I just want to give you a brief overview of what the DC 37 benefits are, how they work, and how they will work for you once you retire. So any forms that we discuss or any information that you need in regards to what we discussed today can be found on the DC 37 website, which is www.dc37.net. In addition, I have sent over the slides to Taylene, and so that she can share them with you guys if you need additional information. If you need to get in contact with DC 37, the telephone number is 212-815-1234. Okay, so what benefits are covered under DC 37? So DC 37 is the welfare fund benefit through the union, and we cover you for dental benefits, prescription drugs, optical. We do have short-term disability, but today we will not speak about that because this is pre-retirement. So once you retire, you will not be eligible for that benefit. Audiology and death benefits, and as well, we'll also get into legal services. Okay, so the first benefit that I want to speak to you guys about today is the DC 37 dental benefit. So the company that we currently use for dental benefits is Delta Dental. You and each person on your plan is entitled to $1,700 per calendar year. The DC 37 calendar year runs from January 1st until December 31st. So if you do not utilize the $1,700 within that time frame, you do lose it. However, when January 1st comes around, it's replenished. If you're part-time, you're covered for 75% of the DC 37 fee schedule. So this $1,700 does not have to be shared amongst you and your dependents. It is for each person on your plan. So when we speak about dependents, that would be your spouse, your domestic partner, and any children that you have up until the age that he or she reaches 26 years old. We don't cut the children off on their birthday. They are covered until the end of the month that they turn 26. and that can be your natural born children or adopted children. Okay, so if they are dependent under your plan, they will receive $1,700 per calendar year. In addition to the $1,700 a year, if you are full-time, you're also entitled to $1,840 once in a lifetime for ortho benefit. The ortho benefit is braces, okay? So the way that the Delta Dental plan works is that it goes according to where you reside. So it's two different networks. If you reside in New York, the network that you would be using is the New York Select Network. If you reside outside of New York, you would be using the Delta PPO network, okay? So if you are actively working right now and you are residing in New York State, you're going to be using the New York Select Network. A lot of our retirees relocate once they retire. So if you relocate once you retire, you will then be switched into the Delta PPO network. The only thing you have to do for that change to happen is to update your address with DC37. Once we see an out-of-state address, we will send you the Delta PPO network card, which will allow you to go to dentists outside of New York State. Now, Delta Dental is a big organization. They don't just have DC37 members under Delta Dental. So we do have a designated DC37 phone number in place for our members, as well as a designated Delta Dental website for our DC37 members, okay? So you can call that toll-free number and utilize the website in order to find a dentist in your area, or to find out information regarding the Delta Dental plan. On your card, there is information about the Delta portal. I would suggest that you sign up with the portal so that if you have any claims that you're waiting to be reviewed or approved, you will get notification through the portal that that claim is ready to view. Okay. All right, so the next benefit is the optical benefit. So you and each person on your plan is entitled to an optical voucher once every 2 years. In addition to the optical voucher, if you're eligible for a pair of computer glasses, you are entitled to that as well, but the computer glasses is just for the member. The vouchers covers an eye examination, single vision lens, and a pair of DC37 frames at a participating provider. If you decide to go out of network, then you would have to utilize the optical reimbursement, and that is up to $250 reimbursement once every 2 years. So as an active worker, if you are residing in New York State or the tri-state area, you can utilize the voucher. But if you relocate once you retire, anywhere outside of New York or Florida, you would have to utilize the reimbursement method. Okay, so if you need to, you can utilize both in conjunction with each other, the voucher or the reimbursement, if you're residing within the tri-state area. Just remember that the price of the voucher will be deducted from the reimbursement. So the price of the voucher is about $25 or $26. So if you use both together, they would just deduct the $25 from the $250 reimbursement. Okay, so if you need to request an optical voucher for you or any of your dependents, you would just give us a call so we can check and see if you're eligible. If you need a reimbursement form, we do have those forms available on the DC37 website. So in addition to the two benefits that we just discussed, we also have a prescription drug benefit, okay? So as an active worker, the company that we utilize for you for your prescription drugs is Optum Rx, okay? So anyone who is actively working, or if you are a retiree that is not yet Medicare eligible, the company you'll be using is Optum Rx, okay? Once you retire and you are Medicare eligible, we switch you over into the DC37 Medicare Part D prescription plan, which is Aetna with SilverScripts, okay? DC37 is a generic drug plan. So I put a little chart on the screen so you can see how it works for your medication. You have an option of picking up your prescriptions from a retail pharmacy, or you can utilize the mail order program. So I definitely encourage you, if you have a medication that you take on a regular basis, that you utilize the mail order program, okay? So just to give you a little idea of how it works, take a look at the chart, the first line, generic. If you were to get a generic medication at a pharmacy for a 30-day supply, it would cost you $10. If you get that same prescription at the pharmacy for a 3-month supply, it would be $30. However, if you utilize the mail order program, that same 90-day prescription would only cost you $20. So basically what's happening is that you will get a 3-month supply of medication, but you only pay for 2 months by utilizing the mail order. So if that's something that you're interested in, we do have those mail order forms available on the DC37 website. Okay. Now, with the Aetna with SilverScripts, once you retire, and we'll get into that a little later, there will be some documents you need to submit to DC37, and we will automatically put you over into the Aetna plan at that time. If you're retiring and you are under 65 years old at the time, but you have a spouse that is over 65 and Medicare eligible, what we would do is keep you in the Optum Rx plan and enroll your spouse into the Aetna with SilverScripts plan, and vice versa. If you are over 65 when you retire, you will be in the Aetna plan, and if your spouse is not 65 yet, they would stay in the Optum Rx plan. If you're over 65 and retired and you have medication that you were receiving through the PICA program for injectables or chemotherapy, those medications will then be switched over to the DC37 Aetna with SilverScripts plan. Okay. All right, so the audiology benefit is a benefit that DC37 provides for your hearing, and this benefit is a member-only benefit. Okay, so your dependents, unfortunately, are not able to utilize this benefit. I'm not sure if you guys know, but DC37 has a health center located at 115 Chambers Street. Within that health center, we have our audiologists, we have dentists, and we also on the first floor have an Advantage Care, okay, like an urgent care. So you can utilize those services there at 115 Chambers Street. If you're using the audiology benefit, it has to be utilized there at that particular center on Chambers Street, okay? This benefit covers a hearing evaluation and hearing aid if necessary. The hearing aid would be a left hearing aid and a right hearing aid, and it's once every 3 years for replacement of that hearing aids. So if you need to make an appointment for audiology services, you would call 212-791-2126. All right, so the death benefits. DC37 does give a death benefit. So if you pass away when you are active full-time worker, the death benefit is $10,000. If you are a part-time active employee, it's $6,000. Once you retire, that amount is reduced to $2,000. Okay. We do ask that you keep your beneficiary information updated. So if your beneficiary has moved or changed their phone number, we ask that you let us know, that you update that on the new form so that we can contact them in the event that we need to pay them out. You can update the form anytime that you like, and you can put as many people as you like. Just keep in mind that the more people you put on, they would have to split the amount of the benefit, okay? Those forms are available on the DC37 website. Now, what happens with your benefits in the event you pass away is that the benefits will continue for your dependents for 1 full year from the date of your death. After the 1 year, we automatically send out COBRA applications for your dependent, to purchase the benefit for an additional 36 months. Okay, so the benefit is for the DC37 is not for the beneficiary, it's for your dependents. So just to be clear, your beneficiary receives the money, but your dependents will receive the benefit for 1 full year from the date of death, and then they can purchase COBRA for an additional 36 months. Now, when I speak about the COBRA for DC37, keep in mind that that is different from the COBRA for your health insurance, okay? So even if you're purchasing COBRA for the health insurance, you would still need to purchase DC37 COBRA for the dental, optical, and prescription for an additional 36 months. That's for the dependents, okay? All right. So in addition to all of the welfare fund benefits that DC 37 offers, we also have a legal team, and our legal team is called MELS. Okay. So we have one of the largest prepaid legal services in the country, and we offer the legal services to you as a retiree as well. Okay. So as an active member and as a retiree, you're able to utilize the legal services. Our legal services handles civil matters. They do not handle any criminal matters, okay? And you do have to be within the covered area. Our covered area is New York State, New York City, Westchester County, Rockland County, Nassau County, Suffolk County. So as long as you reside in those areas, you are allowed to continue to utilize the legal services. If you relocate once you retire, unfortunately, you will not be able to utilize the DC 37 legal services. However, sometimes we're able to give referrals at a discounted rate. So some of the things that our legal team handles is preparations of wills, debt matters, billing disputes, adoption, citizenship matters, which is a big deal right now, divorce, separation, annulment, name changes, guardianship. And we do also handle landlord and tenant cases, but we only represent the tenant, not the landlord. So even if you're not in trouble, even if you don't need to utilize legal services for much, we do suggest that you do a will with the legal services. Especially since you're retiring, you can get your affairs in order while you have the benefit available for you. So if you need to contact our legal team, we have a screening department, and that number is 212-815-1111. Even if you're not sure if it's something that they handle, just give them a call, and the screeners will let you know if there's an attorney available to assist you for the matter that you need, okay? So let's just talk about some important things that you need to remember as you are going on your journey to retirement. So we ask that you notify DC 37 of your retirement. The reason being is that there's going to be documentation that you have to submit to us so that we can continue these benefits for you, okay? If you are not Medicare eligible at the time of your retirement, the documentation that we're going to need from you will be different from the people who are Medicare eligible. So just give us a call. We'll let you know what you have to submit, and we'll also let you know where you will be submitting the documentation to. If you relocate, we do not get information from the agency once you are retired. So it's going to be up to you to let us know that your address has changed, your phone number, or your email address. So we do ask that you keep us updated with how to find you, okay? Also, good news, you will not pay union dues any longer once you retire. However, you can join the Retirees Association if you like. It's free of charge for the first year. After the first year, it's $3 a month. And if you are with the NYCHA's pension, that $3 can be directly taken out from your pension. So the Retirees Association have monthly meetings where all of the retirees gather. You get lunch. You get coffee, cakes, everything. You come out to the meetings and hear about all the happenings with DC 37 and the city. Okay. Also, they have trips. They do phone banking, and they just keep the retirees active and involved. Okay. So just give them a call for an application if that's something that you might be interested in. So some other important things to remember. We do know how important all of the benefits are to you and your family. So just keep in mind that in order to continue these benefits once you retire, you will have to have at least 10 years in the pension so that these benefits will continue for you. So I'm going to open up the floor to any questions that you may have.
Crystal, there's a couple of questions that people put in the chat. One of them is, so I'm just going to read them to you. Can Delta Dental be used if you're outside of the New York area?
Yes, Delta Dental is a nationwide benefit. So that benefit, I'm just going to put so I can see you guys. Okay. Okay. So Delta Dental is nationwide. So even once you retire and you relocate, you will be able to utilize Delta Dental.
Okay. And the other question is, the DC 37 vision, the optical benefit is $250 a year, but this person goes to the New York City Tech Optical Center for glasses, how can they get reimbursed?
So we have the reimbursement forms available on our website. You would just need to, it's a very simple form to fill out, just general information, name, address, social or ID number. And then you would just attach a copy of proof of payment so that we can see how you paid and how much so we can reimburse you.
Thank you.
You're welcome.
Does anybody have any questions that you can unmute yourself and ask if you'd like?
Yeah, I have one question about dental.
Sure.
Yes, I just want to clarify that I think because in the past when I call a dentist, they said, yes, we received Delta Dental, but then when I said DC-37, they say, oh no, we don't work with that provider. So I think it has to say also Delta Dental NY Select, I think.
So Delta Dental, as I was saying, it's a huge company. They don't only have DC-37 members. We're not the only one who utilize Delta Dental. So when you are looking for a dentist under Delta, it's very important that you use the designated website and phone number. It's going to take you directly to just the Delta that covers DC-37. So those will be the providers under New York Select that accepts DC-37 Delta.
Thank you.
You're welcome.
Claudia James.
Yes. I know about I wanted to ask about the legal mails.
Yes.
I know we pay every year they take a deduction from us before tax. And when you retire, do you still have to do that if you're gonna use the mails?
Good question. So the amount that you see coming out your check is the taxes for the prepaid legal services. So at the end of the year, you do get a legal fringe that shows you what the taxes are on that. So when you retire, you would still see that. But if you relocate and you're not able to utilize the mail services, you will not have that coming out.
Okay. Thank you.
I got a question, one. Hello. Hello?
Yes, go ahead and ask.
Yeah. Hi. So, as I understood right, I have 1,700 per year, right? So I went to the doctor. Doctor told me that procedure will cost me $1,500. I said, I have this 37 insurance. He said, yes, of course, we will use this insurance, but keep in mind, insurance will pay us $50 and you have to pay us $1,450. Is it right?
So a lot of times if you go to the dentist, they say, yes, we will accept it. That means they will let you come in. You can have the work done, but you're going to pay. So it's very important that you go through the DC-37 designated website to make sure that that dentist is 100% participating with us and that you won't have
Yes, I did it. And still, you know, this situation was like, I have to pay most of this procedure, you know, and
what I would suggest, because I don't know the specifics of this situation, what I would suggest is that you give a call to 212-815-1234, and they will be able to look that up and see maybe if the procedure is, if there's a frequency limitation on a procedure, or if it's a procedure that may not be covered under the fee schedule, or it could be something else. So they would have to take a look into your specific situation.
okay, thank you very much.
You're welcome. Someone is asking about the link for the DC-37 Delta Dental. I'm going to share the slides so that you guys can have access to the phone numbers as well as the websites and the links, okay? I'm just checking the chat. I don't, yeah, someone says congratulations to the Knicks. Congratulations, everyone.
I think we got to all the questions.
Questions there? Okay, perfect. All right, thank you guys so
Anybody
much.
else have any? One last opportunity before we move on. No? Going, gone. Okay.
Okay, take
Thank you
care.
so much,
Thank you for
Crystal. We
having me.
appreciate your time.
Thank you.
Okay. Our next presenter is from the New York City Department of the Aged. His name is Antoine, but I will avoid saying his last name because I'll probably butcher it, but maybe he can say it. Are you there, Antoine?
Yeah, hi. Yeah, my full name is Antoine Orisesguerra, and it's
Okay.
nice to meet everyone here. Thank you for having me.
Nice to meet you too. Thank you. I believe I've made you a host, so you can go ahead and share your screen.
Perfect. I'm going to share it now. Okay. Just to start off, my name is Antoine, and I work with the New York City Department for the Aging's Medicare Counseling Health Insurance Information Counseling Assistance Program, or HICAP for short. And we here at HICAP provide counseling and assistance to Medicare beneficiaries, regardless of whether they have the retiree health benefits or not. And our program primarily consists of volunteers that man the phone lines to answer any questions the public may have on Medicare. And today I'll just go into a brief presentation on enrolling in Medicare, as well as the costs to Medicare coverage. So what is Medicare? Medicare is it's a federal health insurance program primarily for people aged 65 years or older, for those who have Social Security disability benefits, as well as for people who may have end-stage renal disease. Going over the different parts of Medicare, you have Medicare Part A, which provides your insurance coverage for you as a hospital inpatient, or for services covered at a skilled nursing facility or rehabilitation center. Now, Medicare Part B provides outpatient medical insurance coverage for your doctor's visits or lab work or physical therapy or occupational therapy, as well as preventive services or preventive benefits. Now, for Medicare Part D, that is for prescription drug coverage. And typically, most people from the general public do get drug coverage through private standalone plans. But for those with retiree health benefits, or for those who are eligible for retiree health benefits, such as yourselves, they may typically have drug options that are considered to be creditable coverage, meaning that their benefit is either equal to or better than a Medicare Part D plan. So that credible coverage may come from your union or through the city's retiree health benefits as a drug rider. There is another letter to Medicare, Medicare Part C, which is otherwise known as the Medicare Advantage Plan. This is another pathway for getting Medicare covered services, which bundles together Medicare Parts A, your hospital insurance, B, your medical insurance, and D for drugs under one plan. It is primarily run by private health insurance companies, and I'm not going to elaborate on this plan any further because this plan is generally for the general public, and it is especially not for you. So if you hear ads on TV, or if you hear licensed agent brokers trying to suggest and say these terms, Medicare Advantage or Part C, and that it's by a private health insurance company, don't even bother listening to them. Be sure to always reach out to your former employer or your retiree health benefits first before considering any steps, because you don't want these to interfere with any of the retiree health benefits that you have. So that is just a general overview of Medicare. Now, I'm just going to be going into the aspects of enrolling in Medicare in both Parts A and B. First, I will go into Medicare Part B, which again is for your outpatient medical insurance coverage. So first, for Medicare Part B enrollment, you can enroll in Medicare during your initial enrollment period, which is the 7 months surrounding the month of eligibility, which is generally the 7 months surrounding the attainment of the age of 65. You can enroll in Medicare as early as in the 3 months before the month that you turn 65. So if you enroll in the first 3 months before the month you turn 65, then Medicare Part B will start the first of the month that you turn 65. Now, if you enroll in the last 4 months of that initial enrollment period, the last 4 months consisting of the month you turned 65 and the 3 months after you turned 65, then Medicare Part B would start the first of the next month. Now, for the special enrollment period, if you have health insurance coverage through your own or your spouse's current active employment and not domestic partner, yourself or your spouse's active current employment, you may not need to enroll in Medicare Part B when you become first eligible. Again, we primarily want to focus on coverage through your own or your spouse's active employment, not a domestic partner. So if you have active employment-based coverage when you're first eligible for Medicare, you can delay enrollment in Part B without penalty, because in this situation, you would still have your health insurance through your employer as primary coverage, and Medicare would still be considered secondary. So you would qualify for a special enrollment period to enroll in Medicare Part B while still working, or within the 8 months following the month in which you lose active employment-based health coverage. Now, you wouldn't want to have a gap in coverage, so we wouldn't recommend that you enroll in Part B sometime in the 8 months following retirement. People applying for Medicare Part B in the special enrollment period, while still covered under active employment, or the first month no longer covered under active employment, can choose for Medicare Part B to start either that month or in one of the next 3 months. So one of the forms that you would have to fill out when applying for Medicare Part B, which I will go into in the next slide, it has a field where you can select when to start Medicare Part B, and you can start it as early as 3 months out from the date of when you apply for it. So if you know the date of your retirement, you can potentially apply for Medicare Part B as early as 3 months before that point, so that once you retire, you won't have any gap in coverage. So I also just want to talk about the general enrollment period. This is primarily for people who don't apply for Medicare Part B during their initial enrollment period and who may miss out on their special enrollment period because they may not have health insurance coverage covered through their own or their spouse's active employment. So if you didn't apply for Medicare Part B when you should have, then the only opportunity for when you could apply for Medicare Part B would be during the general enrollment period, which is from January through March of every year, in which Part B would start the first of the next month. So if you don't have Medicare Part B when you should have it, then you may be liable to a late enrollment penalty of 10% of the monthly premium for that year for every full 12 months that you were not enrolled in Medicare Part B when you should have been. But again, just to recap, you can enroll in Medicare Part B during your initial enrollment period. That's the 7 months surrounding the month that you turned 65, or through the special enrollment period if you were continuously covered from health insurance coverage under your own or your spouse's active current employment. Before I go on, I know that was a lot. I just want to ask if there were any questions about that. Okay, good. So how do you enroll in Medicare Part B? You can enroll using, for the special enrollment period, you would need to fill out 2 specific forms. One form is the CMS 40-B form. That is the application to enroll in Medicare Part B. And that application has the field where you can select when to start Medicare Part B as far back as 3 months out from the point of filing. And then the other form that you would have to have your employer fill out is the L564 form, which is a documentation indicating that you had continuous health insurance coverage through your own active job-based employment or your spouse's active job-based employment. So those are the two forms that you need to fill out if you were to apply for Medicare Part B beyond the age of 65, if you were to continue to work, but at some point later on you retire. So now I'm also going to go into the enrollment for Medicare Part A. If you are receiving, or if you're eligible for Social Security retirement benefits, regardless of if you're receiving it or not receiving it yet, you would be eligible to have Part A for premium free, meaning that you don't have to pay any monthly premiums to have Medicare Part A. Now, if you are receiving Social Security benefits, Medicare Part A is mandatory. It's mandatory at 65 and over if you are receiving Social Security retirement benefits. Now, if you are not collecting Social Security retirement benefits, then Part A is voluntary, for which you could still apply for during your initial enrollment period. Beyond that, you can enroll in Part A at any time. It isn't subject to any of the periods that I previously talked about for Medicare Part B. Medicare Part A, there is no reason not to have Medicare Part A because it is free coverage in terms of the no monthly premiums that you have to pay for it. And it would, if you continue to work and have health insurance coverage through either your own or your spouse's job-based employment, then Medicare Part A would be secondary to that health insurance coverage through your own or your spouse's employment. It could pay anything after your primary insurance has exhausted all the benefits for your inpatient hospital coverage. Now, if you apply for Medicare Part A down the line, later on beyond the age of 65, there may be some retroactivity in terms of when Part A would be effective, because it can be retroactive of up to 6 months. Let's say if you're beyond the age of 65 and you apply for Medicare Part A at some point in time, if you apply in December, the Medicare Part A may be retroactive back to be effective in June of the same year. So that's Medicare Part A and Part B in terms of the enrollment aspects. Now, this would be the red, white, and blue card that you would receive once you apply for Medicare. If you were to get Medicare but not get Medicare Part B, because you continue to work, you may just receive a red, white, and blue card that says hospital insurance only. And then, of course, if you retire later on, beyond the age of 65, and you use that special enrollment period to apply for Part B, so to ensure that you do not pay any monthly penalties on top of the base premium, then you would receive a new card indicating that you would have both Medicare Parts A and Part B. Again, Part A for your hospital insurance coverage and Part B for your outpatient medical insurance coverage. Now, next, I'm going to talk about the costs in Medicare, the cost sharing expenses that Medicare would put on the onus on the beneficiary for both Medicare Parts A and B. First, what I want to talk about is the income-related monthly adjustment amount. So the standard Part B premium is a monthly premium. This year, that's $202.90 per month. And for those who have higher incomes, for individuals, that's $109,000. And for married couples, that's $218,000. They would be responsible for higher premiums. There would be a surcharge on top of the base premium of $202.90. So this is otherwise known as the Income-Related Monthly Adjustment Amount, or IRMA. And what defines income, or what defines the top line here that you see as modified adjusted gross income? Now, Social Security, which partially administers the Medicare program, determines whether a person is subject to IRMA based on their tax return from 2 years ago. So if you were to apply for Medicare Parts A and B this year, then Social Security would look at your tax return from 2024. And they would look at 2 lines on your tax return from 2 years ago. And those 2 lines, which includes your tax-exempt interest income, That's line 2A of your 1040 tax return, and your adjusted gross income, which is line 11 of your tax return. You add those two lines together, and that's what makes up your modified adjusted gross income. So those two incomes added together adds up to your MAGI income. And then from there on, they would look at this chart and determine where you fall in terms of that modified adjusted gross income. And if you fall into any of these income brackets, then you would be paying the corresponding Part B premium. So say, for example, if your modified adjusted gross income is less than $109,000 for a single individual, then you will only be paying the standard Part B premium of $202.90. Now, if your income is over that, let's say if your income is between $109,000 and $137,000 from the tax year, of 2 years ago, from 2024, if you were filing this year, then your Part B premium would be $284.10. Now, the income-related monthly adjustment amount is reevaluated each year. Even though, for example, if for 2026, it would be based on your 2024 tax return, you can still request that the Social Security Administration reconsider your IRMAA amount based on a more current year's income because of a potential life-changing event, such as a change in work status, in which you can submit a specific form to the Social Security Administration called the Form SSA 44. And that's how you could potentially lower your tax bracket to ensure that you're paying a lower monthly premium. And of course, I will be going into a reimbursement program later on for which the city can reimburse you for all the premiums that would be that you would have to pay for.
Antoine,
yes.
could I just ask you a question about that? So
Yeah.
it used to be 4-tiered, so they've increased the tiers?
Yes.
When did they do that? Is that new?
I believe it was very recent. I believe it was either this year or last year. They
Okay.
they did segment. Well, so if you see yeah, so right now it looks like it's 6 tiers now for
Right.
individuals, magi, and married couples. And yes, I do believe it was either this year or last year where they segmented it out even further.
Okay.
Yeah.
Someone is asking, can you please explain it again at the 2-year look back? Just the 2-year look back.
Yeah, so for the 2-year look back, so when you apply for Medicare Part B, what the Social Security Administration does is that they would look at your tax return from 2 years ago. So if you apply for Medicare Part B this year, they would look at your tax return from 2024, and what they would look at are the 2 lines on that tax return, your tax-exempt interest income, which is line 2A, and they would also look at line 11, which is your adjusted gross income, and they would add those 2 lines together, again, from the tax return from 2 years ago, and then they would determine what your Medicare Part B premium would be. So again, if your income, your modified adjusted gross income, those 2 lines from the tax return from 2 years ago, if it's less than $109,000 as a single individual or $218,000 or less as a married couple, then you would just be assessed to pay the monthly standard Part B premium. If it was any greater than that, then you would fall into one of the other categories in which you may pay a surcharge on top of the standard Part B premium.
Can I just add something, Antoine?
Yeah.
So because they look at your income 2 years prior, a lot of people who retire are subject to this IRMAA premium because it's not based on your income the year that you retire. It's based on 2 years prior when you probably have been working the entire year and probably at the highest salary of your career.
Right.
So if you think that you're being overcharged and that your income is going to drop considerably once you start receiving a pension, you can contact them and ask them to reassess. and base it on your current income rather than 2 years prior. So you can ask them to do that so that you're not overcharged for IRMA.
That's right, exactly. So you can contact the Social Security Administration and have them reassess your income-related monthly adjustment amount, your IRMA amount, based on a more current year's income because of a life-changing event, such as that change in work status, which may lead to your income dropping from once you retire. Yeah, it's a very common topic. Okay. So for paying the Part B premium, for people who with Medicare who are collecting Social Security benefits, the premium is automatically deducted from your Social Security benefits. Now, for those beneficiaries who do have Medicare Part B but are still deferring their Social Security retirement benefit, if they want to defer it to their full retirement age, or if they wanted to defer it to the age of 70, then they would receive a quarterly bill statement from Medicare directly in the mail via snail mail. And it would give you the opportunity to pay for that bill via a check or by calling Medicare or by even going online by creating a Medicare account to pay for the premiums online. There is a way online where you can pay the Medicare Part B premiums on a monthly basis as opposed to paying it in quarterly increments. But also just wanted to note that the Part B premium bills are due on the 25th of every month. So that is kind of how you would have to pay for the Medicare Part B premium. Again, that is $202.90 per month this year. So for those who are eligible for the City of New York Retiree Health Benefits Program, as well as their dependents, they are eligible to receive retiree health benefits entitlements to the reimbursement of the Part B premium, as well as the income-related monthly adjustment amount, that IRMA surcharge on top of the Part B premium. So as an example, you'll see here that if, say, for example, you had Medicare in 2025 and you paid for all the Part B premiums for that year, last year's monthly premium amount was $185 a month. You multiply that by 12, that's a total annual premium amount of $2,220. You will see that in April of the following year, so in this year, you would receive a reimbursement amount of the $2,220 in a one-time lump sum refund in April. Now, for the IRMA surcharge on top of the standard Part B premium, you would have to apply for that every year, and that would be refunded to you in May of the following year. Now, for the standard Part B premium reimbursement program, that program is automatic after applying in the first year as a retiree. So for your standard Part B premium, once you apply for that program, then you are automatically receiving the reimbursement for the standard premium in April of every subsequent year. But for the IRMA reimbursement, if you are subject to the income-related monthly adjustment amount surcharges, you would have to apply separately for that every year. Now, I also just want to note that the Retiree Health Benefits Program under the city, there is no entitlement to reimbursement of any late enrollment penalty surcharges or any Part D IRMA surcharges for drug plans if you were to consider a drug plan from the public plans. That is not something that you can be reimbursed for by the City of New York Retiree Health Benefits Program. So this is just kind of a general overview of the Part B reimbursement program, which is a very, very beneficial program that you would be eligible for as a city retiree, especially since most of the public would just have to pay for the Part B premium. Now, next, I'm going to go into how the cost sharing expenses work once you actually receive the healthcare services. First, I will start off, I'm still just sticking with Medicare Part B. So in addition to the monthly premium of $202.90 per month, if you were to have a Part B covered service, again, outpatient services, doctor's visits, lab tests, physical or occupational therapy, MRIs, specialist visits, etc. You would first have to pay out of pocket a one-time annual Medicare Part B deductible amount of $283. And once you meet that amount, then how it works is that the government, specifically Medicare, would pay for 80% of the Medicare approved claim amount for covered services, and you would be on the hook for up to 20% of the Medicare approved claim amount. Now, laboratory tests, as well as most preventive services and preventive benefits, such as cancer screenings or diabetes screenings, those are free of charge and are not subject to deductibles or co-insurance, especially the preventive benefits. And I'm also going to go in later on into the secondary plans that help pay for these cost-sharing expenses. So that's just a general overview of how the cost-sharing expenses work under Medicare Part B. I also just want to go into certain types of providers. There are doctors and other medical providers that can choose to have different relationships with the Medicare program. They can either be participating providers or non-participating providers, or they can also be opt-out providers in which they opt out entirely of the Medicare program. Now, the provider's relationship affects how much you'd have to pay for their services. So, participating providers, essentially, that means that they will always accept the Medicare allowed amount as payment in full, in which Medicare pays 80% and you would be on the hook for up to 20% after you meet the Part B deductible. If you want to find out whether a provider is participating, you can, of course, check the Medicare.gov website or call 1-800-Medicare. Now, for non-participating providers that still have a relationship with Medicare, they can either choose to accept assignment or not accept assignment on each claim. And assignment is essentially, if you accept assignment, that means that you accept the Medicare allowed approved claim amount, in which as payment in full, in which Medicare would pay the 80% of the approved claim amount, and you would be on the hook for 20%. Now, again, so if the provider accepts assignment, they would accept Medicare's approved claim amount in full, in which they would not charge you more than 20% co-insurance for certain services after you met the Part B deductible. Now, if a provider does not accept assignment, the charges may be subject to a limiting charge. And essentially, the limiting charge, or otherwise known as an excess amount, is an additional charge over the Medicare approved claim amount. The federal limiting charge is 15%. That's a national federal limiting charge. But some states, such as New York, do have lower limiting charges. So in New York State, physicians who do not accept assignment for a particular service can charge no more than 5% above the Medicare approved claim amount, except for certain things such as home and office visits that are, they can charge up to the 15% federal limiting charge. So that's just kind of a bit of an overview of the differences between a participating provider and a non-participating provider. Just seeing a non-participating provider doesn't necessarily mean that the provider does not accept Medicare. It just means that in addition to accepting Medicare's amount, they can charge you above that 20% co-insurance. Generally, again, in New York State, it would be capped at 5% on top of that 20%. Now, I also want to make a distinction between non-participating providers and opt-out providers. So providers who opt out of the Medicare program must enter into a private contract with any Medicare beneficiary who seeks their treatment. They would set a fee for each specific service, and you would agree to pay the costs in that contract, understanding that Medicare will not pay the doctor or reimburse you and that the provider is not limited by Medicare as to how much they can charge. Your retiree health benefit as well may not pay for any of these costs either, especially if Medicare won't pay for these costs. So again, a non-participating provider is a provider who is still willing to accept Medicare's amount, but on top of that, they may still be able to charge you a bit above the Medicare approved claim amount. They can charge you, again, an additional 5% in New York State, 15% nationally. Whereas opt-out providers, they are completely out of the Medicare program. So if you hear a provider who is completely opted out, that means that Medicare will not pay, and therefore your retiree health benefit may not pay, and that you would have to sign a contract indicating that you acknowledge that, and that you would bear the full brunt of the claim. So this is just kind of a summary of what we've talked about. Again, you'll see that out of all the providers in the realm, you'll see that participating providers completely accept assignment and are always accepting the Medicare approved claim amount, in which the government pays 80% and you pay 20% of the approved claim amount. And then for non-participating providers, they can either choose to accept assignment, which would then be the same criteria as for those who are participating, or they can choose to not accept assignment, and that they can charge more than 100% of that Medicare approved claim amount of up to 15% nationally and 5% in New York State. And then again, you have your opt-out providers who do not take Medicare at all, meaning that you would have to bear the brunt responsibility of paying for the entire claim in full. And of course, you would receive advance notice of that because you would have to sign a contract indicating that you acknowledge that. Now, before I move on forward, I know that that was also a lot to talk about. Are there any questions whatsoever? Okay, all right. So next, I will go into the cost-sharing expenses under Medicare Part A for your hospital insurance coverage. So again, this is for you as an inpatient in the hospital. First, if you were to be an inpatient in the hospital for the first 60 days of hospitalization, you would have to pay a deductible amount of $1,736. That is for the first 60 days of hospitalization. Now, if you continue to be hospitalized beyond the first 60 days, then you have what we call co-insurance days, where from days 61 through 90, for those 30 days, you would be paying a co-insurance amount of up to $434 per day. So that's for the first 90 days of hospitalization. Now, beyond that, if you continue to be hospitalized from days 91 through 150, then you would be on the hook to pay what we call lifetime reserve day coinsurance amounts of $868 per day. And again, that's per day, daily coinsurance amounts. Now, I also just want to make note that these lifetime reserve days can only be used once in your lifetime. Once you've exhausted those lifetime reserve days beyond days 90, then you no longer would have that sort of coverage in which you can pay the $868 per day. And I also just want to note that these are not annual figures. It's not that you exhaust all of these coinsurance and deductible amounts and then you are good for the rest of the year. That is not how this works. These only work within what we call benefit periods. And essentially what a benefit period includes is when you have been in the hospital, you're considered an inpatient, you've been formally admitted as an inpatient in the hospital, and then you've been discharged for more than 60 days, and that on its own is considered a single benefit period. So let me give an example. Let's say, for example, that you are considered an inpatient in the hospital for 45 days, and then you've been discharged on day 45, right? So you've cleared almost that 60-day inpatient deductible amount. And let's say that you have been discharged for less than 60 days. So less than 60 days, you've been out of the hospital, and then you go back into the hospital and you are still, you've become formally admitted as an inpatient. And now, because it's been less than 60 days since you've been discharged, you are still within this inpatient deductible phase in which you would just start off on day 46, right? So that is if you've been discharged for less than 60 days. Now, let's say, for example, if you, let's say you were in the hospital for 65 days. So you fulfilled the entire inpatient deductible and you've started to pay the coinsurance amounts for the first 5 days of $434 per day. And then you are discharged from the hospital and you've been discharged for more than 60 days. And again, this is within a calendar year, so it's the same year. And then you go back to the hospital. So bear in mind, you've been discharged for more than 60 days. Now, because you've been discharged for more than 60 days, you go back to day one. This starts all over again. So that is a benefit period. And in terms of I also just want to briefly talk about the skilled nursing facility. This is, say, for example, if you've been discharged from a hospital and you go to a rehabilitation center. The first 20 days of coverage for the skilled nursing facility is completely free of charge. But then from days 21 through 100, you would be on the hook for up to $217 per day. Now, I don't mean to scare you with all these figure amounts, because these figure amounts, these cost sharing expenses, are only if you don't have any secondary coverage to fill in these gaps. So what I'm going to talk about next is one of the most comprehensive health insurance plans that city retirees are eligible for, which is the GHI Senior Care Plan for New York City retirees. Again, from what we've noticed, most New York City retirees who are eligible for the Retiree Health Benefits Program are enrolled in the GHI Senior Care Plan. There are an abundance of other plans that city retirees are eligible for, but from what we've noticed, many of the New York City retirees do end up with GHI Senior Care because of how comprehensive it is in terms of the very low cost sharing expenses as compared to others. So essentially, the GHI Senior Care component is a secondary plan that supplements traditional Medicare, and it fills in the gaps, those cost sharing expensive amounts that I just talked about. It fills in those gaps so you wouldn't have to be paying those figure amounts. It is a combination of Anthem Blue Cross Blue Shield, which supplements your Medicare Part A hospital insurance. Again, not the 80-20% that's covered under Part B, the Medicare Part A cost sharing expenses, the ones that I previously talked about in the last slide. And then the other component, which is a combination of GHI and Emblem Health, supplements your Medicare Part B covered services. Again, that is the 80%, 20% that we're referring to for outpatient services. Now, when it comes to Medicare Part B outpatient services, there is a component where GHI Senior Care does not cover the annual Medicare Part B deductible of $283. So how it would work is that if you would have this coverage, you would first have to pay the Medicare Part B deductible of $283. And then after that, you would have to pay an additional $50 deductible that is prescribed by the GHI Senior Care Plan. And once you've met those two deductibles, while previously the plan covered the entire 20% coinsurance, as of January 2025, how it stands now is that after you meet those two annual deductible amounts, the $283 from Medicare and the $50 deductible from GHI Senior Care, Emblem Health, then you would have to pay $15 copayment amounts for services. Again, including any visits to your primary care provider, specialist, etc. Physical therapy, all of those would be subject to the $15 copayment amounts. And I've also added the link here for from the New York City Office of Labor Relations in terms of what the GHI Senior Care component entails, as well as what is listed and considered for services in which you'd have to pay the $15 copayment amounts. Something that I also do want to mention is that if you see a provider that takes Medicare, but they are a non-participating provider, so they can choose to bill the additional excess charge or the limiting charge of up to generally 5% in New York State. The GHI Senior Care component does not cover that excess charge. So say, for example, if you paid the annual deductible of $283 and you also paid the $50 deductible to Emblem Health, then you would still be on the hook for up to 5% of that additional excess charge. The 20%, again, you still may pay that $15 copayment, but for non-participating providers who don't accept just Medicare's payment in full, they would, again, charge you an additional up to 5%. You would still be on the hook for up to 5%. So you should be very mindful when looking for providers to see and ask, do they take Medicare and are they considered participating providers? Again, the majority of providers in the United States are participating providers. I believe it's about 90% of the providers in the United States that takes traditional Medicare and are participating and take assignment, but a small minutia are either non-participating or opt out, in which non-participating the GHI Senior Care component won't pay for that excess charge. And then, of course, for opt-out, the GHI Senior Care component won't pay for that because Medicare won't pay for that. But this is a very good supplemental coverage to have because it supplements traditional Medicare. And regardless of the provider, if you see a provider that takes traditional Medicare, whether it's in New York or Alaska or California, traditional Medicare will pay, and GHI Senior Care will also pay part of those coinsurance amounts. You would just still be subject to the $15 copayment amounts. So that is just a general overview of the GHI Senior Care component. Before I move on, any questions on that regard?
Are there any limitations territorial-wise, geographically, for the GHI Senior Care?
No. So the GHI Senior Care kind of acts as a supplemental secondary plan to traditional Medicare. So as long as the provider takes traditional Medicare, then GHI Senior Care is obligated to pay most of the cost share and expense, of course, minus the 2 deductibles and the $15 copays. So this will work in any of the states you visit throughout the country as long as the provider takes traditional Medicare.
Could you say that GHI Senior Care fills the donut hole that they usually speak of with people who have Medicare? If you're familiar with the term donut hole.
The donut hole was primarily for Part D prescription drug coverage, which had been in effect several years prior, but that had been eliminated recently, I believe, as early as 2022 or 2023, in which for Part D coverage, and I don't know what the retiree health benefits are in terms of drug coverage. Generally, there is an out-of-pocket maximum for that. I'm sorry, go ahead.
The drug plan that they are going to be covered by for most of the people on this call is the DC-37 drug plan. So that donut hole would not have really applied to you anyway.
Right.
Gotcha.
There you go. So there is just an out-of-pocket maximum, and there is no like catastrophic donut hole. That, for the most part, nationally has been eliminated.
Thank you.
Yeah, absolutely. Those are good questions. So next, I'm just going to go into non-covered services that traditional Medicare does not cover. So traditional Medicare and thus the supplement your secondary coverage won't cover for dental care or routine vision and eyeglass wear, hearing aids, long-term care, routine annual physical exams, and services outside of the United States. And I also want to pinpoint and focus on the routine annual physical exams because there is a difference between the annual physical exam and Medicare's annual wellness visit. So the annual physical exam assesses overall health and identifies existing health problems through lab tests, vital signs, and physical examinations. Whereas the annual wellness visit, it's a bit more preventative. It provides preventive care and health risk assessments, as well as updates to health history and family history. It doesn't necessarily comprise of any hands-on exams nor lab tests. I just want to make that distinction for traditional Medicare. Now, again, beyond that, Part B, Medicare Part B, the outpatient component for your medical insurance coverage, does have an abundance of preventive services that are free of charge, such as, again, cancer screenings, diabetes screenings, mammograms, etc. That are not subject to any cost-sharing expense. But again, they are also based on limited frequencies. There are limited frequencies in terms of how often you can have those preventive benefits. So that's all that I have to share. And again, if you have any questions whatsoever, we do have a hotline that you can reach out to in terms of your Medicare benefits. You can reach out to 212 Aging NYC, and you can ask for a HICAP counselor. For anybody who is outside of New York City, as well as outside of New York State, we do have our own equivalent, since this is a federally funded grant program. Outside of New York City, you have the corresponding phone number for the state number, which would bring you to your local county's jurisdiction, your local SHIP HICAP program. And then, of course, outside of New York State, you would have your own, there is a website in which you can locate your own state's corresponding program. We also do other introduction to Medicare webinars that go more in depth into the nuances of the Medicare program. This particular presentation is primarily focusing on just traditional Medicare, as well as components that are eligible to you as City of New York retirees. And yeah, we have webinars that are online, as well as in-person workshops at the Department for the Aging in downtown Manhattan, where we just go over a general overview of the Medicare program, as well as the differences in how people can get their coverage. So that is all I have to say, and I appreciate your time listening to me here, and just want to ask out if there were any additional questions. All right. If there aren't any, yes, there are booklets available for just a comprehensive overview of Medicare for New Yorkers. Now, bear in mind, it also has other things that you should not be mindful of, such as the Medicare Advantage plans or the instances for people who might have Medicare and Medicaid, but we do have booklets. And if you want a booklet, we can ship it out to you. You can obtain a booklet by just calling that 212 number and just indicating that you would want to have a booklet shipped to you. I believe these slides are also going to be shared out with you all. And yeah, if there are no other questions, I just want to thank you so much for your time. Thank you.
Is that booklet they're referring to, does that come from Medicare directly?
No. So we also have Medicare and You booklets. That comes from Medicare directly, but we have our own in-house booklet that is primarily for New Yorkers, for people who reside within the 5 boroughs.
Oh, so if I live outside of the 5 boroughs, then that information doesn't apply?
Generally, so some of the information may apply, but there are certain instances where it may not apply. Like say if you live out of state, then there are certain figures that might be different for those who live out of state.
Well, I
But
live
again, yeah,
upstate.
I
Upstate. That's
yeah.
invalid.
So in that case, I don't know if your own jurisdiction's SHIP HICAP program is if they have their own booklets, but you can reach out to your own SHIP HICAP program by calling the 1-800 number, which I can definitely put in the chat.
So are you saying that if I want these services that you talked about, I have to be using facilities in New York City?
If you want like counseling or just assistance in understanding your Medicare services, because you live in the Hudson Valley, I would route you to your local SHIP HICAP program, which provides the same assistance that we do.
Okay.
And I will put that number in the chat for everybody. Again, this is for those who live outside New York City, but in New York State. I do see here a question in the chat. It was a private message. How often is the $50 deductible paid? I'm assuming that that's in reference to the GHI Senior Care Emblem Health component, that $50 deductible. That is an annual figure amount. So again, once you pay the annual Medicare Part B deductible of $283, after you meet the $50 once you pay the $283 deductible to Medicare, then you would have to pay a $50 deductible for Emblem Health. And then after that, for coverage services, you'd only be paying the $15 copayment amount.
Thank you, Antoine.
Thank you.
That was great.
I
So
appreciate it.
comprehensive. Thank you so much. I really appreciate your time and expertise.
I appreciate that. Thank you for having me. And again, thank you, everyone.
Okay, so our next presenter is Ravi Gopal from Social Security Administration. And as I mentioned before, I have to stop recording because I am not allowed to. So I'm going to stop.